2026 Mental Health ADHD Practice Review. Question 1. A client is experiencing progressive changes in memory that have interfered with personal, social, and occupational functioning. The client exhibits poor judgment and has a short attention span. The nurse recognizes these as classic signs of which condition? Option A, delirium. Option B, mania. Option C, Parkinsonism. Option D, Alzheimer's. The correct answer is option D, Alzheimer's. The client's presentation of progressive memory changes, poor judgment, and attention deficits align with classic signs of Alzheimer's disease. Alzheimer's is a neurodegenerative disorder characterized by cognitive. Question 2. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A, providing information about effective nursing techniques. Option B, identifying risk factors that contribute to the development of a disorder. Option C, identifying individuals in the general population who will develop a specific disorder. Option D, identifying which individuals will respond favorably to a specific treatment. The correct answer is option B, identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 3. What assessment question will provide information to the healthcare provider regarding the effects of a woman's circadian rhythms on her quality of life? Option A. How much sleep do you usually get each night? Option B. Does your heart ever seem to skip a beat? Option C. When was the last time you had a fever? Option D. Do you have problems urinating? The correct answer is option A. How much sleep do you usually get each night? The correct assessment question to understand the effects of a woman's circadian rhythms on her quality of life is to inquire about her sleep duration. Circadian rhythms significantly influence sleep patterns, so. Question 4. Which patient should be most carefully assessed for fluid and electrolyte imbalance among those receiving the following drugs? Option A, lithium escalate. Option B, clozapine, clozaril. Option C, diazepam, Valium. Option D, amitriptyline. The correct answer is option A, lithium escalate. Lithium escalate is the correct choice because it has a narrow therapeutic index and is excreted almost entirely by the kidneys, making patients highly susceptible to fluid and electrolyte imbalances. Lithium. Question 5. When a patient with major depressive disorder is started on fluoxetine, what is the most important side effect for the nurse to monitor? Option A, weight gain. Option B, suicidal ideation. Option C, hypertension. Option D, hyperglycemia. The correct answer is option B, suicidal ideation. When initiating fluoxetine therapy in a patient with major depressive disorder, monitoring for suicidal ideation is crucial due to the increased risk of suicidal thoughts or behaviors that can occur, especially in. Question 6. Which medication is commonly prescribed for the treatment of panic disorder? Option A, haloperidol. Option B, clonazepam. Option C, lithium. Option D, fluoxetine. The correct answer is option B, clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous. Question 7. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A, has no memory of the physical abuse he endured. Option B, using both alcohol and marijuana. Option C, often reports being unaware of surroundings. Option D, reports feelings of not really being here. The correct answer is option B, using both alcohol and marijuana. The correct answer is B because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 8. In the treatment of generalized anxiety disorder, GAD, what medication is frequently prescribed as a first-line treatment? Option A, clonazepam. Option B, buspirone. Option C, propranolol. Option D, hydroxyzine. The correct answer is option B, buspirone. Buspirone is often chosen as a first-line treatment for generalized anxiety disorder GAD due to its efficacy and favorable side effect profile. Unlike benzodiazepines such as clonazepam A, buspirone does not. Question 9. Which assessment question asked by the nurse demonstrates an understanding of comorbid mental health conditions associated with major depressive disorder? Select one that doesn't apply. Option A. Do rules apply to you? Option B. What do you do to manage anxiety? Option C. Do you have a history of disordered eating? Option D. Do you think that you drink too much? The correct answer is option A. Do rules apply to you? Questions about anxiety management, disordered eating, and alcohol use are relevant to identifying comorbid conditions with major depressive disorder, but the question "Do rules apply to you?" does not directly. Question 10. A patient with post-traumatic stress disorder, PTSD, is experiencing flashbacks. The most appropriate intervention is to: Option A. Encourage the patient to talk about the trauma. Option B. Help the patient reorient to the present. Option C. Leave the patient alone to process the flashback. Option D. Remind the patient that the flashback is not real. The correct answer is option B. Help the patient reorient to the present. When a patient with PTSD is experiencing flashbacks, the most appropriate intervention is to help them reorient to the present. This intervention can assist in reducing the intensity of the flashback and providing a Question 11. A male patient calls to tell the nurse that his monthly lithium level is 1.7 milliequivalent/L. Which nursing intervention will the nurse implement initially? Option A. Reinforce that the level is above the therapeutic range. Option B. Instruct the patient to hold the next dose of medication and contact the prescriber. Option C. Advise the patient to go to the hospital emergency room immediately. Option D. Inform the patient about the possibility of seizures and appropriate precautions. The correct answer is option B. Instruct the patient to hold the next dose of medication and contact the prescriber. A lithium level of 1.7 meql is above the therapeutic range, indicating a potential risk of toxicity. The initial nursing intervention should be to instruct the patient to hold the next dose of medication and. Question 12. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A. Excessive sleeping. Option B. Low self-esteem. Option C. Decreased need for sleep. Option D. Anhedonia. The correct answer is option C. Decreased need for sleep. The correct answer is C. Decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 13. Ted, a former executive, is now unemployed due to manic episodes at work. He was diagnosed with bipolar I 8 years ago. Ted has a history of 4 drug abuse, which resulted in hepatitis C. He is taking his lithium exactly as scheduled, a fact that both Ted's wife and his blood tests confirm. To reduce Ted's mania, the psychiatric nurse practitioner recommends: Option A. Clonazepam, Klonopin. Option B. Fluoxetine, Prozac. Option C. Electroconvulsive therapy, ECT. Option D. Luridone, Latuda. The correct answer is option C. Electroconvulsive therapy, ECT. Electroconvulsive therapy, ECT, can be an effective treatment for reducing mania in patients with bipolar disorder who have not responded to medication. In Ted's case, where he has a history of bipolar I disorder. Question 14. In addition to anti-anxiety agents, which classification of drugs is commonly prescribed to treat anxiety and anxiety disorders? Option A. Antipsychotics. Option B. Mood stabilizers. Option C. Antidepressants. Option D. Cholinesterase inhibitors. The correct answer is option C. Antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors (SSRIs) and serotonin norepinephrine reuptake inhibitors (SNRIs), are frequently used in the treatment of anxiety disorders. These medications help. Question 15. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 16. When explaining suicide precautions to a client, what would be the best explanation? Option A. You need to control yourself. If you cannot, we will do it for you. Option B. This can seem embarrassing, but we want you to be safe. Option C. You will stay on these precautions for 1 week. Option D. When you feel you are safer, then we will not need to observe you. The correct answer is option D. When you feel you are safer, then we will not need to observe you. Choice D provides a supportive and empowering explanation to the client on suicide precautions. It emphasizes the client's own sense of safety and control, indicating that the observation is temporary and can be. Question 17. Maggie, a child in protective custody, is found to have an imaginary friend, Holly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations, acknowledging and supporting. Question 18. In pediatric mental health, there is a lack of sufficient numbers of community-based resources and providers, and there are long waiting lists for services. This has resulted in select one that doesn't apply. Option A. Children of color and poor economic conditions being underserved. Option B. Increased stress in the family unit. Option C. Markedly increased funding. Option D. Premature termination of services. The correct answer is option C. Markedly increased funding. The lack of resources in pediatric mental health leads to underserved populations, increased stress in the family unit, and premature termination of services. However, markedly increased funding does not align with. Question 19. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive Option A. Chlorpromazine. Option B. Phenelzyme. Option C. Haloperidol. Option D. Olanzapine. The correct answer is option D. Olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances. Question 20. A patient diagnosed with bipolar disorder is experiencing a depressive episode. Which medication is commonly prescribed for this phase of the disorder? Option A. Valproic acid. Option B. Risperidone. Option C. Fluoxetine. Option D. Lithium. The correct answer is option C. Fluoxetine. The correct answer is C. Fluoxetine. Fluoxetine, a selective serotonin reuptake inhibitor (SSRI), is commonly prescribed to manage the depressive episodes in bipolar disorder. SSRIs are effective in treating the. Question 21. In what order should the following goals be approached for a client being treated for alcoholism? Option A. Learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C. Abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D. Abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 22. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD)? Option A. Haloperidol. Option B. Sertraline. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 23. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A, hypotension. Option B, sexual dysfunction. Option C, increased appetite. Option D, tachycardia. The correct answer is option B, sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors, SSRIs. SSRIs can affect sexual function by causing issues such as decreased libido, delayed. Question 24. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A, sertraline. Option B, lithium. Option C, clozapine. Option D, haloperidol. The correct answer is option B, lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 25. Which statement by the patient indicates a need for further teaching regarding the treatment of major depressive disorder? Option A. I have been on this antidepressant for 3 days. I understand that the full effect may take weeks to occur. Option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Option C. I may ask to have my medication changed to Wellbutrin due to the problems I am having being romantic with my wife. Option D. I realize that there are many antidepressants and it might take a while until we find the one that works best for me. The correct answer is option B. I am going to ask my nurse practitioner to discontinue my Prozac today and let me start taking a monoamine oxidase inhibitor tomorrow. Choice B indicates a need for further teaching because the patient is planning to switch directly from Prozac, an SSRI, to a monoamine oxidase inhibitor, MAOI, without allowing for a washout period. This abrupt